Hello, welcome to the skeletal system on Chapter 8, starting on page 178 of your test book. This week we'll learn about the skeletal system, which is kind of it's the framework of our body, the wood truss, the wood beams, and basically, metaphorically, that our body has, just like in a building, has things to hold structure. That's what holds our structure. But not only that, our skeletal system does a lot of other functions, which we'll get into. As a reminder, just to let you know, next week we will not have a quiz on a skeletal system, but your skeletal system will be tested on in the midterm, which is in 2 weeks, June the 16th. So after your lecture, you'll be going to lab. In lab, starting at 1300, 1 o'clock p.m. Mountain Standard Time, will be available your SIN gauge assignments. Those are due on the 9th of June, so please use them to study with, and you'll be able to progress and have success on your midterm. Forgive me for my scratchy voice. I'm getting over something, but we'll make it through. Now, the skeletal system, like I said, it's our framework, but it also does other functions: support, protection, movement, storage, and hematopoiesis. So let's take a look at what that means. Provides internal framework that supports the body. As we all know, that if you just even touch your body, the hardness of your body, the structure, why you stand up tall, why you're upright, is because it's internal framework due to the skeletal system. But within that, those bones, they protect a lot of internal organs, such as your heart, your spinal cord, your kidney, your lungs, uh, even your guts, your colon, your liver. It all has a shield over it that deals with your skeletal system. But within that, it helps fight disease by producing white blood cells. White blood cells is what your body uses for immunity. In the future weeks, modules, we'll talk about immunity and the blood types and blood in general. But right now, I want you to know that inside of your bones, we have bone marrow. White bone marrow creates white blood cells. That's what your body uses as its immune defense, as well as makes movement possible by working in concert with muscle contraction and relaxation. Each muscle needs a bone to be attached to for the muscle to move. So that's where our skeletal system is big. Actually, when healthcare looks at it, they look at what they call it the musculoskeletal system. But we're going to divide each system and delineate it as skeletal and muscular. And then when you learn about both of them, you can put them together. Also, our body stores our calcium that we receive in our bones. So if our body needs calcium, it can get it from the bones. If the bones need calcium, it gets it from the blood. It's a back and forth function that our body does that receives calcium from outside sources. That is stored in our bones, as well as making red blood cells. That's what the word hematopoiesis does. It forms blood cells in a process called hematopoiesis. That's what makes red blood cells. So that way your body can receive oxygen, you won't get anemic, and you won't have cyanosis if we have enough red blood cells going to the parts of the body. So let's look at the 4 bone types. So when you're looking at the 4 bone types, and you can follow me on page 179, we're looking at the names, and the names deal with the shapes. So they're named according to their overall shape. So let's look at the first type, long bone. We have a humerus. That's the big bone in your arm. Another long bone is your femur. That's the one on your thigh. The longest bone actually is that. Um, the example, that's a long bone. If you look on page 179, you'll see a long bone look. All right, that's a long bone. Then we get to short bone. If you feel your wrist, you have many, many bones in there. Those are called carpal bones. Those are what we'll term as a type of short bone. Then you get your flat bones. If you rub your head, a lot of y'all have thick heads. Just kidding, but those bones in your skull are what they call flat bones. Then we'll get to what they call irregular bones. Your spine. Your spine, they kind of look like spaceships. Those spinal bones are called irregular. Why? Because they're made so that way your spinal cord and ganglion and nerves can protrude out of them, but they're protected. There's also another type to understand. They're called sesamoid bones. Why? Because it comes from a word, sesame seed. They're little round bone categories. So something like that would be your knee bone, your kneecap, and your patella is what it is. That's called a sesamoid bone. So these are the different types. Now let's go back to long bone. And I want you to tune in on page 179. And like I said, figure A-1, that'll help you see what we're talking about. Because I want you to know each component of the long bone and be able to recognize, and on a test to be able to, if you were told where is something like the diaphysis, you could go to it. So let's look. The diaphysis is the longest part of the bone, and inside has a hollow tube, but it's what they call compact bone. So that's the middle part of your bone, and that is the diaphysis. Now, inside of your diaphysis, the hollow tube is called the medullary cavity. We talk a lot about medulla, middle. So that's how you can think about this medullary cavity. It's a hollow space inside the diaphysis that contains yellow bone marrow. That yellow bone marrow is what we make our white blood cells out of. So see how in the beginning we talked about function and we talked about things as support and immunity. There we go. So we had the yellow bone marrow. A lot of people like to eat this in bones, right? Because if you ate anything you cooking, marrow is actually creates flavor. Not to be weird. Then we have the epiphysis. Epi means above. Well, we have them on each end. So each end of the bone, the ends of the bone is your epiphysis of the long bone. And if I were to cut it frontally, you will see that inside looks like spongy bone. So just take a look. That spongy bone is that what the epiphysis is made out of, whereas diaphysis has a lot of compact bone. So you'll see the two different types of tissue definition. So the epiphysis has spongy bone. Now another thing about the epiphysis, that's where red bone marrow is made. So we get our red blood cell factory out of there. So which is really cool about the bones, we not only make immunity, but we do what they call hematopoiesis. So that's a red blood cell formation, and that's what we want. Then we get to the cartilage. If you look at the very distal ends of the long bone, they have what they call articular cartilage. To articulate means to move. When two things come together, they articulate it. Just like when we talk, when you enhance your voice, you're articulating. Or when you're trying to describe something to an extent you articulate, you want to move the word to a higher extent. Well, our joints, where two bones come together, they need to move, so they articulate. Well, we need cartilage to have a smooth articulation. If you guys ever had bone on bone, it's very painful, and the sound of it, or If you guys walk and you hear a lot of snaps and pops, that's because you may have some rubbing, right? Well, our bone's going to rub, but if we have like a protection, a cap on it, that's the articulation. That's where our cartilage comes from. So it really provides a cushion for that articulation. Then we get the jackets, the periosteum. Peri meaning around, just like we had perineurium we learned last week or the week before in the nervous system, we have periosteum. So it's strong fibrous membrane covering the bone everywhere except at the joint surface. Because at the joint surface, that's where we have the articular cartilage, but everywhere else we have periosteum. So take a look at 179 and understand each component. But one more in the visceral space inside of the bone, especially if you look at the medullary cavity, we have what they call endosteum. Endosteum. Anytime you see the word OSTE, you're thinking bone. Endosteum. That lines the medullary cavity. So please look at each component on page 179, figure 8-1 to really understand it. You will have to know each component of that long bone. Here's a picture of it, the same picture I'm talking about from figure 8-1. Like I said, we have the diaphysis, which is the longest part, dia meaning through. Then we have the epiphysis on each bones. And right here, this blue part is the articulating cartilage, made out of cartilage. We're going to talk about cartilage. If you look right here, you see a bunch of holes like Kit Kats. If you open up a Kit Kat, that is what they call cancellous bones, diplo or spongy bone. Then you get to in there, in those little cavities, you have what they call red marrow. Here's your medullary cavity in the middle of your diaphysis, and inside of that has endosteum. But if you look on the outer part, the more anterior part is compact bone. Then we get to, in the diaphysis, the yellow marrow. And on the outside of this whole bone, except on the epiphysis, we have periosteum. So that's how that's broken down. Now let's look at flat bones. So if you turn your page to 180, you'll see what they call flat bones. We talked about flat bones being in your skull. A thin layer of compact bone, so compact on the outside, surrounding spongy or diplo bone in the inside. So it makes kind of like an Oreo or Kit Kat sandwich where it's hard on the outside but spongy in the middle. Okay, they're very thin though. It's not like where you have the long bone, which is a big robust bone. So the open spaces within the spongy bone surrounded by the bony trabeculi. We're going to talk about what trabeculi is in a second, but what I want y'all to know about trabeculi, it's like a matrix network that where your bone has kind of, how can I say, has all its blood functions, its vascular functions, and it shows the framework, the support. So that's the more microscopic part in each bone. So here's what on page 180, if when we talk about figure 8-2, see, I think of it like a Kit Kat or some of them, those candies there where they're chocolate on the outside, then they have that little crunchy thing in the middle, and then chocolate again. But that's what our skull bone has. So it's very smooth, compact, and diplo, spongy bone, cancellous. So they have three words. So let's look at the microscopic structure and whole, and this would be in your page, how can I say, chapter 8, 181, I'm sorry, page 181, figure 8-3, microscopic structure of the bone. So earlier I said, we're looking at the bone. This is getting real deep. It has its own vasculature. See how it kind of, when we get to the spongy bone, but as it gets in microscopically, they call it trabeculi. So it gets spongy, as we know. This is the long bone. Here's the spongy part. But as we go microscopic, we're going to call it trabeculi. And then each side of each compact bone, this is where our bone cells is. You have what they call the caneculi, the central canal, concentric lamina. Whenever you're concentric, means circles, circles. We have osteocytes. Those are the sites that make bone. Osteocytes. Osteo means bone, site means cell. And they're in what they call lakes, lacunas, big gaps. The lacuna is a big gap. Lacunae, it's a Latin word for lake. If you guys speak Spanish, laguna is the derivative of lake. It's the same thing. Then each bone needs its own blood supply and 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 how can I say lymph supply, so that way we can have oxygen, carbon dioxide out, waste out. Okay, and when you see that, it goes inside of the concentric circle in the central canal. That's where that canal. So to really break down this figure right here, and like I said, it's page 181, figure 8-3, because this is where it gets microscopically. So when we're looking at the compact bone, compact, the structural unit is an osteon calcified matrix. We just talked about that, arranged in multiple layers or in rings called concentric lamina. So go back, those circles, just a bunch of circles, just like wood. If I were to chop a branch of wood, have circles. Then it gets to the bone cells, which are called osteocytes, and those are found in those little gaps. They're called lacunae, which are connected by tiny tubes called caneculi. So each gap has a canal that's caleculi that supports that as well. And it's all covered by the periosteum. Go back and look at each component. You are responsible to know the anatomy of the microscopic part of the cell, of the bone. So osteon, the Haber-Bosch system, we're still talking about bone, OST. Structural unit of osteon or Haber-Bosch system is, let me see, we just talked about, is a concentric lamina. So stay on page 181, and as you're hearing these, really look at them. Circular or calcified matrix. So the matrix in other things is very fluid-like, right? Those spaces where you don't have like a cell, it's very fluid-like. When a bone, it's calcified, it's very hard. And it, like I said, in bone, it's circular. So as the lacuna spaces between the lamina containing the osteocytes, so that's where the cells are. Caneculi are canals, passages that connect each lacuna and all nutrients to reach the osteocyte. I'm repeating myself so you guys see it as you go. And in the central canal, osteon contains the blood vessels. So I just repeated what I told y'all, but I want to make sure it sticks. Still with the bone, we're looking at the structural unit called the osteon. Now, when you look at the osteon, and you still, or the osteon Haber-Bosch system, the spongy bone that are found in the epiphysis. Remember, the spongy bone is found in the epiphysis, appears porous, holes, naked eye with many open spaces. And then the space contained, that's where the red marrow is, the red bone marrow, and the textures, as we get very, very microscopic, needle-like threads called trabeculi. So now we're going to take a look at the different other tissue type called chondrocytes. Chondro, as I told y'all, we talked about that being cartilage. Chondro means cartilage. So if you look on page 181, figure 8-4 underneath what we've been looking at has a different histology of either bone, osteons, or chondro or cartilage tissue. I really want you to be able to distinguish each one and really get a feel of what it looks like. They're all started from the same derivative, the same mother basically, but they ended up being their own individual structure. So chondrocytes, right? Chondro meaning cartilage, site meaning cell, are located in what they call the lacunae. So the lakes, just like in compact bone, the osteocytes were in the lacunae. In cartilage, chondrocytes are still in the lacunae. But if you look at the matrix, it's a flexible gel-like substance that lacks blood vessels. So touch your ears, touch your nose. That's all cartilage. Lacks the blood vessels, whereas in compact bone, it has the blood vessels. So let's take a look at bone and bone development and how this all starts. Two things we got to know right away is certain words, and these words are going to help you define as we keep going further. We're going to want to know what osteoblast and osteoclast are. So right away, we're thinking osteo. Osteo means bone, but clast and blast. And I could tell you a way how to remember it. But let's go to page 182 and really see where this figure comes from, figure 8-6. And if you look, bone-forming cells are called osteoblasts. Bone-forming cells are called osteoblasts. I always think of like forming, blasting off, blasting into like the rocket going into space. Blast, osteoblast, bone forming. Where on the opposite, bone dissolving cells are osteoclasts. That means dissolve class. So please understand the difference. I want them highlighted in your book, so that way you can see it. Page 182 under bone development, it's highlighted, first column. Please know that, because as we start reading and you hear these things about bone development, you'll be able to recognize what's going on. But let's just take a look at this figure, which is in your book as well. And it says during bone remodeling, bone dissolving osteoclasts remove hard calcium salts in the bone matrix. Osteoblasts then form, that's what A is showing, then form a new bone marrow in the area. Okay? Blast, here we go. Oh, these are clasts, but new bone marrow, and then it says until they eventually become surrounded and trapped by hard bone and then called osteocytes. Then we go from, okay, so here's the osteoclast dissolving existing bone. Then osteoblasts come in, form the new bone marrow, and then all of a sudden, once they start becoming surrounded and trapped, they become osteocytes. They get embedded and become osteocytes. So let me repeat this. Which I love is when I give you a narrative, then these slides will help you edify what we're talking about. So new bone forming cells are called osteoblasts, and bone resorbing cells are osteoclasts. So the ability of bone to ossify, see bone, OSS, grow or change shape, heal after injury, or respond to stress occurs because continuous sculpting by osteoblasts and osteoclasts. So it's this dance that they have to make sure you have enough bone and that your bone doesn't overgrow, but that it continues to grow. So bone is formed by two processes. Most bones develop from a process called endochondral ossification. Big words. These words mean something. Endo, inside, chondro, meaning what? Cartilage, ossification, meaning bone formation. That's what it does. So what this is going to tell you, that bones are going to start off cartilage, and inside of the cartilage, it's going to go into it forms bone. So some flat bones, skull bones, form connective tissue membranes by another process. We could talk about that, but right now, let's look at the endochondral ossification. Matter of fact, turn to your page 182, and we can look at figure -8-7 because it's really good. It goes from A to G, and if you look at it, the blue the blue parts are cartilage. When it gets red, it's calcified cartilage. When it turns white, it's bone. And then as it keeps going, it'll get periosteum in light blue, and then the blood vessels will form. So bones develop from cartilage models. Center of ossification first appears in the diaphysis. So in the middle of the bone, the middle of the cartilage, uh, the central part, that's where the ossification starts. That's the diaphysis. Centers of ossification then develop in the epiphysis. So it goes from from medial to anterior or to distal. Okay? So your diaphysis will ossify first, then your epiphysis. Then as that goes towards end, you'll start getting in your epiphysis a plate, meaning that it'll section itself off in the epiphysis, and that epiphysis will section off the diaphysis and epiphysis between them, and it will remain until the bone is mature. And once it gets matured, you'll get what they call a epiphyseal line. That's just bone. And the cool thing of that's what we call your growth plate. Replaces the epiphyseal plate cartilage when growth ceases, when growth stops. So a lot of times people look and see if you're still going to grow based on if that epiphyseal line has been calcified, and then we know that your bone has stopped growing. That's your growth plate. And here's a repeat of what that figure 8-7 says on your page 182 and 183. Please take a look at each one and know each process. So also early bone development before birth consists of cartilage and fibrous structure before birth. So this is in utero. This is basically what we have, how we are when we're little, inside the stomach still growing. So cartilage models gradually replaced by calcified bone matrix. This is how we talked about. It's called endochondral ossification. So this truly happens not only as we're living, but inside of the fetus in our mother's uh, uterus or belly or whatever, honey pot, whatever you want to call it. Before the stork gives you stork bite, comes pull you out. That. All right. So osteoblasts, you see how osteoblasts blasting off, forming new bone, and osteoclasts will reabsorb the bone. Because it keeps it from overgrowing, right? Because you don't want a grown child or a grown infant coming out of the birthing canal, or you want to take time to grow. So bone development, you can see this on page 184. Um, there's a figure 8-8. See how your bone develops? We have what we call the fontanelles. If you guys ever held a newborn or hold newborns, you got to be careful with their head. Soft spots. These soft spots help them get out of the birthing canal. You know, it gives it pliability. As we get older, those bones fuse, start to suture. That's where we have the lines between are suture. Then look at that. When we come out, our maxilla is already calcified. Our mandible, those are the places you guys are going to like to work. This is going to be all you guys' warehouse here. Our spine is pretty much calcified, except in the interspinal spaces that stay there. Our shoulder bones are calcified. I mean, our collarbones, our shoulders are starting to get some of our cartilage, and so on and so forth. Take a look at that. Now we're going to talk about a lot of anatomy. This, as we continue in our anatomy, I want you guys to look on your pages. We're going to start on 184, 186, 187, 188, all the way to 189. These bones in here are bones I really want you guys to know, pay attention to. Now, when I test you, your test that you have to know on your midterm and on any of your final, or quizzes or forever is on the axial skeleton. AXIAL. There's 80 bones. If you look on table 8-1, they separate axial and appendicular skeleton. Out of 206 bones you have in your whole body, they're separated into divisions, and axial and appendicular. Okay, so the 80 bones you will have to know. Now you think each 80 bones? No, but there's mandatory in every quiz we're going to do. It's going to have a skull bone. You have to know all the bones of your skull. Okay? Bones of your skull and your vertebrae. So we're going to talk about that, but we're going to keep going. So axial skeleton consists of your skull, spine, which is your vertebral column, and your thorax. Your appendicular skeleton has 126 bones, upper extremities, shoulders, lower extremities, including hip and pelvic. Now, I'm really not going to test you on those because you guys are dental hygienists. I'd rather really develop you and have you really learn and be perfected on your axial skeleton, because those are the ones you're going to use consistently. So page 184 has a good table that separates each one. And if you look at page 185, it separates the axial skeleton from the appendicular skeleton. So that's good to know. So you learn, you could see it. Plus, we're going to do sin gauge today in your lab. You're going to get very familiar. I want you guys to make your cards, make your index cards, because every test from here on out is going to either have a skull bone or a nerve, a cranial nerve on there. A skull bone or a cranial nerve. Now for your midterm, I will test you on the spinal column, the ribs, but especially the skull, the bones of your skull, your cranial bones, should I say, your facial bones, and those are very important. Cranial and facial bones are very important, especially for you guys being dental hygienists. These are things you'll have to know, just like your cranial nerves. Okay, so let's begin. Um, if you look on page 187, like I said, to find all 186, 187, you have table 8-2, bones of the skull, cranial. It'll talk about that. And then 187 has a diagram. Please, if you have to, if you need to stop by, ask any faculty if you could borrow a model of the skeleton or bones of the skull. Please make sure you do that, especially if you're one of those tactile learners. You like to touch things. This helps. Even if you're not, I suggest all you guys take your time. If Cengage helps you, it's really good. If you just the book helps you, but if you get a chance to really touch these things, see where they're aligned, look at the sutures, look at how these things come together, it will really help you, because you will not only have to know this for my class, but as your upcoming semesters, the knowing this is going to be very paramount and required. Okay. But first, so 187 will have the skull bone. Then I want you to look at page 188. 188 is what they call the sinuses. What are sinuses? Before I get to the neck, I want you guys to know what your sinuses are. Well, your sinuses are, if you look, paranasal sinuses, okay? What those do, they're open spaces in your skull. They're open spaces because your skull is very hard, and as it fuses together, it doesn't have any type of flexibility. It stays still, which we want, right? We don't want every time we get hit, we end up with a round head to a cone head to a lopsided head. We want a nice round head. Some of you guys have little pea heads, and you guys probably you may remember this trauma, but having a sinus infection, sinusitis, it's one of the painful. Why? Because our sinuses get blocked, and that bacteria and viruses just build up, almost like um, when you clog the drain in your shower or something. So all that pressure just builds in your head, and it's one of the worst things. You also feel it in your nerves. That's why people, when they have sinus infection, they have tooth pain. Why? Because your skull is fused together after you get older, so it doesn't have much pliability, and the only time it has to release of pressure is through your sinuses. Well, if those release of pressure agents are blocked, then you have no way of getting the pressure out, and you feel a lot of pain. So I want you guys to take a look and understand where your sinuses are, because you will be tested on those, knowing how to locate them. So page 188, figure 8-11. Please take notes. I'm telling you guys now, page 188, figure 8-11 will have your sinuses on there. Please make sure you know how to look at them and understand what they are. Now I want to get to the spine. So I'm on page 189. Now, when we look at the spine, there's different divisions and subdivisions, okay? When we look at the spine, or what they call the vertebral column, there are 4 normal curves, okay? So if you look on page 189, the colors of the spine on figure 814 have green, yellow, orange, blue. All that, those are your 4 main curves. So, and then there's 3 abnormal curves that your spine can be abnormally positioned in. Okay? First one is lordosis, sway back. I call it the twerk. It looks like people that have that when they stand up, looks like they're twerking. That's lordosis. Oh, lordosis, right? And then you have kyphosis. That's the hunchback. That's the quasimodo. Then you have scoliosis. Those are the side, the lean to the side type people, the leaners, right? Because your spine will make an S shape, scoliosis to the side, whereas kyphosis, it'll hunch over. And lordosis, your bottom, where your pelvis is, will stick out towards your posterior side, where everything else will stick to the anterior side. You kind of look like you're twerking, but not with no movement. So how to remember how many spinal bones that we have? You say, dang, that's going to be hard. Nope. First, know the divisions. Cervical, not cervix, but cervical. Anytime you hear the word cervical, you're thinking of your neck, because your neck is the smallest part of your body. So cervical, you're thinking of your neck. Well, in your cervical, we have 7. Your thoracic, it's like your chest area, you have 12. Lumbar, you have 5. Your sacrum, you have 1. And your tailbone, coccyx, you have 1, 2. So that's a way to remember, but that I can make it even more easier for you. Okay? Out of all these bones, which is 26 bones, you have 7 cervical. So what they try to make you remember, like they, as in everybody who does anatomy, one of the acronyms is we eat breakfast at 7, we have lunch at 12, and we have dinner at 5, and then 1 and 1. Now, I know you guys are new school, and most time we eat when we wake up and we have dinner whenever, but usually just say in a perfect world, 7, 12, 5. Breakfast, lunch, dinner, 1 and 1. All right? So let's just even break it down even more so we remember. Thorax is the chest part, because we know our cervical area is composed of what? 7. but the 12 pairs in our thorax, we'll have 12 pairs of ribs. So turn to your page, go to page 182. And also on page 182, when I was talking about lordosis, kyphosis, scoliosis, figure 818 talks about that abnormal curvature. Please understand those abnormal curvature. Some of you guys may even have that yourself. But look at figure 818 on page 192. And then go to figure 8-19 and take a look at that. That's your thorax. That's what we're going to talk about now. 12 pairs of ribs. We have a sternum or breastbone. That's the middle of your rib cages. The lateral sides is the middle. Your sternum or your breastbone is where we do a CPR. That's where CPR comes. It acts like a big plate, the sternum, and that's when you do CPR, you're squishing the heart. Then you have your thoracic vertebrae on the posterior side of that. So you have this round thorax, and you have covered by ribs, sternum, and vertebrae, and clavicle, and collarbone. That makes your thorax. Well, within your ribs, so those 12 ribs, they're composed of ribs 1 through 7, so they're pairs on the left and the right side. Those are called true ribs. Why are they called true ribs? Well, they're called true ribs because they're attached to the sternum. Each bone is attached to a cartilage space connected directly to the sternum. True ribs 1 through 7. Okay? Now 8 through 10 ribs are called false ribs. Why? Because those false ribs, they're attached to the sternum, but they connect to number 7, and they connect to a cartilage that connects to a true rib cartilage that connects to a sternum. So they're not directly connected to a sternum. They have to connect to another cartilage to get to the sternum from the 7th rib. So that's how those are composed and broken down. Oh, and then you have floating ribs. I'm sorry. 11 through 12. The last two, they don't even connect to the sternum. They just float there. They marinate. But there's still ribs out of those 12 ribs on each side. They marinate. They float, as they say. So, as we talked about earlier, the skeleton is composed of divisions, subdivisions, 126 bones in your appendicular, which I'm not going to test you on. I want you guys to survey those. The reason why I don't test you guys on that, because you're dental hygienists, I want you guys to be very knowledgeable and almost perfect with your required bones that you actually work on, your wheelhouse. If you were physical therapy, nursing, so on and so forth, different medical science disciplines, I would test you on different things. But understand that your appendicular skeleton, when they're looking at that division, are bones in the shoulder or pectoral girdle, okay? Connect to bones of the upper extremity, so your arms, your forearm, wrists, and your axial skeleton. Now, we are talking about the axial skeleton because we're talking about the ribs and stuff, but these are your appendicular skeleton, all right? Also, your bones in the hips, your pelvis connect to the lower extremities, your thigh, your ankle, your foot, and they also to your axial skeleton. And if you look at some of the upper extremities, shoulder, arm, forearms, radiuses and ulna, that's where your thumbs are, your metacarpals. All these bones are there. I'm telling you guys this so you guys can survey them and really take a look and know where they're at. But as for me, I will test you on your axial skeleton, not your appendicular. Here's also the lower extremity. Take a read through that. Hip and pelvic girdle form two coxal pelvic bones. Sacrum and coccyx are behind those. That's part of the spine, your sacrum. Your sacral and your coccyx. Each coxal bone is infant consists of separate ilium, ischium, and pubic bones. You have your acetabulum. Then your thigh has the longest bone called the femur, and it's connected to your patella and your kneecap, your sesamoid bones. Your femur is the longest bone, and that's a long bone. Then we get to your foot, 5 metatarsals, 14 phalanges, 3 arches of the foot. Like I said, you will have to know all your AXIAL skeleton, which is all those bones. You are required to know all those bones. Now, as we proceed, we're going to look at the difference between a man and a woman's skeleton. This is pretty cool. It's a generalization, but these are general differences. Size. Male skeleton is generally larger, right? And we know that anthropologically, we know that socially. Some men, not all, this is generalized. Men are taller, bigger than women, right? Shapes of our pelvis. Men's pelvis are deep and narrow, where females have broad, shallow pelvises. This also is true because women have to, not all women, but I'm saying if another human is born into this world, a child, it has to go through a woman. Well, natural birth of it is through the pelvis, so you want a broader, shallow pelvis, a bigger, shallow pelvis, wider hips, so that can, wider hips and wider birthing canals, so that way a human can, enter this world. As well as the female pelvic inlet is generally larger, normally large enough for a baby's head to pass through. So that's not a generalization. Well, it's a generalization, but you see this more times than not. Then you have pubic angle, though, is also wider in females. So if you look, when you hear the word wide, large, and when we talk about the pelvis and the pubis and all that, usually the female wins that, where the males usually we have broader shoulders, we have taller spines, larger bones. So that's anthropologically sound, and science will back that up. Not in all cases that you'll see that sound, but that's what happens. There could be a bigger woman than their male counterpart, but if we took the data statistics, it'd be different. And this is what they're talking about here, comparisons. This is a male, this is a female. Right away from the naked eye, you can see the difference even in the coxal bone, the sacrum width, this inlet, see how it's circled, where this is more of an oval shape. The angle, the pelvic angle is wider. Pubic symphysis here, compared to pubic symphysis there, is wider, whereas the coccyx, look at even the coccyx dimensions. So take a look at that. I like how these hand signals are showing a peace sign and more of an L sign, the loser sign. What are they saying? Women have a loser? No, just kidding. But that's what it's showing. As we get older, which I want you guys to know, always know this, because I'm not teaching pathophysiology in here. You guys will get that as you keep going. But this tends to us in all parts of our body. As we get older, and all body systems get slower, reduced, hardened, and your abilities decrease. The only thing that goes up in your life that increases is your blood pressure. That's the normal part of aging. We are blessed to live these long lives. So don't think, oh man. But the human skeleton is considered to reach its mature state at around age 25. So some of you guys ain't 25 yet, so you're probably still growing. After age 50, the density, the thickness, the thickness and the hardness of the bone often slowly decreases. Now, there's things we can do to fortify or exacerbate these issues is nutrition. How we eat and what we intake can cause variations in one's skeleton, and can mechanical stress. As we put our bones through either harm, or we fortify our bones, that will determine the maintenance on how our bones will live. Not only live, how it'll function for us. Now that was the anatomy of the bones. Now we're going to talk about joints and articulation. We talk about movements, but joints. It's where two bones come together. Now, if you understand, two bones come together, but it also comes together with our articular cartilages in there. So every bone except the hyoid bone, you're wondering what the hyoid bone is. And I want you to go back and take a look at that. Matter of fact, just for the sake of having this and being on video, to look at the hyoid bone. Go to page 188. 188 figure 8-13 will show the hyoid bone, which is the bone that anchors the tongue, connects to at least one other bone. So take a look at it. You have your larynx, which you'll know is the voice box. Then you'll have your hyoid bone. That's it. But that's the only bone that doesn't have a joint. So joint types are classified by the degree of movement. So go ahead and proceed now to page. Let me get you on the page. So you're like, oh man, he don't be telling us nothing. Just kidding. So let's take a look at page 200. 200. So they talk about this. And like I said, articulation are also called joints, because why? It's articulations are movement, but what moves? When two bones come together, you need a place so they can articulate. So as we take a look, there's three kinds of joints, okay? Three kinds of joints. And like I said, they're classified by the degree of movement. For instance, synarthrosis. And let me just put that there. Synarthrosis. Boom, boom, boom. This one. Synarthrosis are no movement. That means they have no movement. Sin, that's a Latin word. Some of you guys speak Spanish or French. Son in French, sin in Spanish means without. That's where they get that SYN. The SYN came first. That means no movement, without movement. Synarthrosis. So if someone says it's a arthrotic joint, that means it's not moving. And then these fibrous connective tissue grows between articulating bones. If you look on page 200, figure 8-26, we'll look at that. Are coronal sutures. So earlier I talked about the skull having fontanelles when you're little infants, so you get through the birthing canal, as you saw in women. It ain't really that big, but it's wider than a man. That way you have flexibility. As we as our bones mature, pretty soon, I mean almost pretty early in life, they get sutured. You know how, like, if you have a suture, you sew them together? Or a bone fuses like that, they call it sutures. And those sutures prevent the skull from moving. And that's when it becomes a synarthrosis. Where all your skull bones come together, they're called sutures now, and they don't move. You don't want, like I said, you don't want your skull to be moving every time you hit your head or you lay down. You'd have some lopsided, ugly heads. So that is fibrous connective tissue grows between there and between the articulating bones. So in our skull, I want you guys to know the names of each suture. Then we have amphiarthrosis. Amphiarthrosis, which means slight movement. Let me highlight it for the kids at home. I love this real-time fun. Look at that ASMR. Let me get that little piece. Some of you guys is OCD is about to kill me. Sorry about that. But slight movement, right? Slightly moving. So let's take a look at it. Cartilage connects articulating bones. For example, your pubic symphysis. If you look on page 200, figure 8-26, letter B has a pubic symphysis. Right there, that's slightly moved. This allows that inlet in that pelvis to move, especially during pregnancy as hormones hit. It allows it to slightly move, to widen out, so that way a child can go through there. Pubic symphysis, or I like how they say it, symphysis pubis. See how it says right here? That's a slightly moving. It's not going to move fully like an arm, but you want it slightly to move. Why? So we can have a child go through there, and at the end of the day, you can return to have a sturdy pelvis. So here's the redo of the picture there. Like I said before, this is the sutures. This part right here, and let me just circle it for you guys. This is on your page 200. And between each bone of your skull, two compact bones come together, two flat bones come together. That's where your joint is. When you're a newborn, an infant, those are called fontanelles. Why? Because they're not fused together. Shortly, they start fusing together, becoming suture. So this bone is called your coronal suture, your crown suture. That's where that word comes from. To what you call your frontal bone and your parietal bones. But those are synarthrosis. They don't move once they've been sutured. But when we get here, amphi, slightly moving, here's your pelvis, here's your pubic symphysis, and this would look like. This is going to slightly move, especially when hormones hit, when you're having birth. Then we have freely moving joints, also called diarthrosis. Diarthrosis, through, that's what dia means. That means freely moving, dia. Okay? Well, we're gonna look at each type. Ball and socket, hinge, pivot, saddle, and gliding. Those are how they broke down. There's a lot of them. And you think about it, you can move your neck, you can move your arm, you can move your leg, you can bend your leg, you can move your feet, toes. All these things are the joints. So this is the bigger portion. You have more diarthrosis joints than you have the other two. So free movement, diarthrosis. Let me highlight that so you guys, your brains can see it. Ooh, don't want that. Sorry about that. Let me go ahead and erase that joker, and let me come back. I'm just having fun, y'all, but I'd like to give you guys something to look at. Ooh, look at that highlighting. Ooh. All right, stay with me, stay with me. I know some of y'all are asleep. Wake up back there. All right, free movement. So most joints belong to this class. Most. So most of your joints are going to belong to this class. Structures of freely movement joints, the joint capsule, and ligaments holding adjoining bones together, but permit movement at the joint. So turn to page 201, or look at 201, figure 8-28. We're going to talk about each individual structure individually. And these are your diarthrosis. This right here, my friends, I think what should be like a knee joint or an arm joint. It's not really saying, but two bones are coming together, so you know there's a joint. They're going to articulate and move. Articulation. Let's look. Structures of freely moving joints. So you have the joint capsule. So this whole thing is the joint capsule, and it says, and ligaments holding bones together. Now, somebody need you guys to take notes, because when you hear this word, your brain should automatically synergize to what it means. So let me The word, let me write it in red. Ligament. What is a ligament? Take some time. I'll let somebody yell it out loud if they know what a ligament is exactly. If not, anytime you hear the ligament, you guys heard of like your ACL, your PCL, MCL, all that's very popular. You hear people talk about, oh man, I tore a ligament. Ligaments hold what they hold is bone to bone. So ligaments hold bone to bone. That's all they do. They're the cartilaginous, woo, that hold bone to bone. Bone to bone. That's what it is. Bone to bone. Okay? When I talk about muscles, we're going to talk about tendons. If you ever hear ligaments, somebody tear the ligament, it's because they tore the support that holds bone to bone. Okay? Two bones together are held together by ligaments. Okay? And then ligaments are at the joints. So if we take a look at the structures of the the articular, then we have ligaments. Let's go back to page 201, figure 8-28. Let's take a look at where there's articular cartilage. We talked about the end of the epiphysis having articular cartilage. That's what covers the ends of the bones and absorbs the jolts. So we have shock absorbers, right? You have that articular cartilage. And inside of that capsule still, we have what they call the synovial membrane. That lines the capsule. And so if you look at the synovial membrane, it where you don't, outside of the capsule and outside of the articular cartilage, there's synovial membrane. What's good about that is that that's where we secrete synovial fluid. So that's some of the shock absorption fluid along with your cartilage, is your articulated cartilage, that makes it so when you walk, you don't have a rub between bones. You have some type of absorption. If you ever had any issues, any inflammation of that, say that bacteria got in there or some type of gout, uric crystals, or any type of issues. Well, I know when I get the flu on myself, any type of viral flu, my joints hurt real bad. And that's because that virus has entered my synovial fluid between my joints and is causing inflammation. And in that is all this is going on what they call the joint cavity, the open space between the two bones. So take a look at each component and know each component of a joint. And here's the picture again. And like I said, here's our two bones. See, this is the epiphysis. You have your cancellous bone. You have the epiphyseal plate. As it calcifies, it becomes calcified, it becomes bone. That way, our growth plate, we know that we're not growing anymore. We have blood supply. And the outside of this is our ligaments holding two bones together, right? Then inside this is the capsule. But look, you have your articulating cartilage on the outside of your epiphysis. This is like green right here. This is your synovial membrane, and that's where your synovial fluid's flowing into this cavity, and all this is creating that joint. Now, the types of, we talked about earlier on the first slide, the types of diarthrotic joints. If you look at doors in your room, they'll have hinges. So those are bones. So let's take an A right here between our elbow, between our radius and our ulna down here and our humerus. We have a joint so we can like flex our arm. Okay, that's called a hinge joint. Moves like a hinge, just like a door. Then we get to our pivot joint, where our neck is, right? I want everybody to shake their head no, shake their head yes. Atlas and axis is what they call those. Those are in our our cervical spine, which is what? How many cervical bones we have? We have 7. So, and they're translated C1 to C7, thoracic T1 to T12, lumbar L1 to L5, and so on and so forth. That's how they do it. But see how that turns? Yes or no? Atlas and axis, that's what we call it. Atlas and axis is a Greek word. If you ever see the picture of it, it's a man holding up the world with a woman on top. No pun intended. Now, saddle joints. Let's think of what a saddle joint is. Let's look at our wrist where our thumb is. Our radial bone is where our thumb is, like turning knobs of a radio. So those are carpal metacarpal joints that allows those movements so we could twist in our wrist and where our thumb is. And then condyloid joints. So let's look right here. Right here. Those are the joints in your jaw. See that? Yeah. You can move your jaw side to side, up and down. Then we get to our ball and socket joint. And you guys have this picture on page 202, figure 829. We have a ball and socket, just like those are our hip joints. Ball and socket. You hear people say, I talk about acetabulum, okay? That's the space in between your pelvis and your hip. We didn't talk about the appendicular skeleton, so I don't want you guys to, to say, oh, I never heard of acetabulum. We didn't talk about that bone. You're not required. We talked about it, but not required. But the joint in there is called a ball and socket. That's where that's located. Then we have the gliding joints. Gliding joints we should know because they're in between each vertebrae. So look at that, gliding joints. So really take a look at this picture and really absorb it. What also I want you guys to know is these terms, and you are accountable to know them, but we're going to keep seeing over again. Types of joint movement. If you turn to page 202, table 8-7, we eat at the tables, we have the types of joint movements. Let's just take a look. Flexion, everybody, y'all flex. Y'all be flexing on me all the time. No, flexion is when you move that joint from an angle as in bending the elbow, okay? As well as, then we have extension. So when you bend it and you put it straight down, that's called extension. Those are the easy ones to remember. Now let's get to one that are easier to remember because you've heard of this before. You heard of, and this is sad, and no pun intended, but people getting abducted. Child abducted. Just go to Walmart. They have all those pictures on the wall. Abduction. That means to take away. To abduct, take away. Let me just put hold on. Let me see what, because they sound the same, especially with my messed up voice. Ab means to take away. So when I abduct, I'm moving my arm or leg or anything away from the midline. Take away from the midline of our body. So just like when you get abducted, you're taken away from your family. Same thing, abduct. Now let's look at the opposite of that. I put that in purple. Adduct. If you ever added something to things, it's to bring it back to the midline, to bring it towards you. So you bring an arm and leg, you adduct, you add it back. Get it? That's the way to think. I'm trying to write this with computer. I know it's probably driving you crazy, but I got your attention. And especially because Mrs. Esparza, she wants you to learn this too, because as she takes you guys to the clinic and all the other faculty, they're going to want you to know these terms and understand how these joints operate. So please, these are the must-haves you must learn. Adduction and abduction. If I'm adding, I'm bringing it back to my midline. If I'm abduct, AB, I'm taking it away. Then we got rotation. Once you guys shake your head no, that's a rotate. You're rotating. Whereas circumduction, the word circle is you're moving the distal in the circle. Circumduct. These words will come back to you guys, so please learn these in its entirety.